So welcome back. A problem was occurred in my net connectivity. That's why I was disconnected for a couple of minutes. So I'm going to share my screen once again. This is very important concept. You should know about it for the best vascular examination of the lower leg. Uh, okay. So here you can see once again we are going to follow the great stiffness fan to and just imagine uh, this is common femoral vein coursing like this, and here this is in the adductor canal, and this is a great stiffness vein moving like this. So I mean this is not a three-dimensional anatomy and a bit difficult, but you can assume that an z-axis, this is towards you, or you can say this is superficial and this means deep. So here you can see this is great stiffness vein, which is superficial, and the superficial uh, fascia, or you can say the stiffness compartment. So the stiffness compartment is guarded by superficial fascia and deep fascia. So this will look like an eye, which is also called Egyptian eye. So this great stiffness vein in short axis view will look like this. Okay. It will have two fascia. This is superficial fascia and this is deep fascia, and this is an eye. Is it eye? Okay, great. So this is called Egyptian eye. Uh, you will know about the Egyptian eye because the people of Egypt thought to be committed of a large number of myths, and one of their myths is an Egyptian eye, so that could bring some benefits and harms to you, and people are keeping it in at their home for anything. I don't know about that, but I think this is not a good belief. So, but here you should know about the eye. So that red subnaswan will appear like an Egyptian eye, and this is superficial fascia, and this is deep fascia, and in short axis view, it will appear like that. So throughout that course, you have to follow it in short axis view to know for any perforator, because the perforator are communication between the deep and superficial venous system. This is superficial, this is deep, and this is perforating venous system. And always, normally the blood flow direction in the perforator will be from superficial to deep. So this will be the direction of the blood flow. If the blood is flowing in the perforating system from deep to superficial, then you can say that this is not a normal course of direction of blood flow. So there are a number of groups of perforator, and you can have multiple side branches of the great saphenous vein as well, and these perforator can also be found between the side branches of the great saphenous vein and the deep venous system. So this region you can follow the entire great stiffness vein in short axis view of the transducer, which is called follow-up of the great stiffness vein in left patient, and then you can evaluate the deep venous system as well as the arterial system from place to place, but preferably it should be evaluated at the adductor canal while making a room access for the shortest distance between the venous arterial system, femoral artery or vein, and your transducer by gently sweeping your transducer to take an excess while avoiding the huge bulk of the adductor muscle. So here you can evaluate the femoral artery and vein at the adductor canal, and then this femoral artery and vein will move posteriorly to the popliteal region, and you can evaluate it in the lateral decubitus position or prone position. So here this is prone position for the evaluation of the popliteal region. So you can place your transducer in short axis view to locate the popliteal vein and artery. By gentle compression, the popliteal vein will collapse, but the popliteal artery will remain the same diameter. So this is the differentiation maneuver of the vein and artery. So here you can differentiate the vein and artery by compression sonography. Okay. Then at the leg region, you will have this type of orientation of different vessels. For example, at the popliteal region, the popliteal vein and artery were divided and two branches. One of the branch was become anterior tibial artery and vein, while the other one became tibio-peroneal trunk. Or soon that tibio-peroneal trunk was divided into posterior tibial artery and peroneal artery. Okay, so this is the posterior part, this is the anterior part of the leg. So in the posterior part you will have posterior tibial artery and vein and peroneal artery and vein, and the anterior aspect of the leg you will have anterior tibial artery and anterior tibial vein. So for the evaluation of the uh, anterior tibial artery, you will have to place the leg and mm, in sagittal position while the knee joint flexed at about 35 degree, and you should place your transducer and between the tibia and the fibula and the anterior side over here in short axis view. So you will have these vessels in short axis. While rotating your transducer like this, you will take access to these vessels in long axis. Then you can turn the patient leg outside to take an easy access to posterior tibial artery and posterior tibial vein, which are coursing like this, just posterior to the medial malleolus. So over here you can have one artery with a protocol of 2 to 7 veins, and they will appear like this in long axis view. Okay, so here you can see one vein is accompanied, one artery is accompanied by more than one veins. So here you can evaluate it posterior to the malleolus, and you can apply gentle compression to differentiate between the veins and arteries and the potency of the veins, and to rule out any thrombus in the posterior tibial veins. And the great saphenous vein is coursing superficial to it, and it's coursing just anterior to medial malleolus. So this is the course of the great saphenous vein. So the same way you have to follow it in short axis view with the transducer to the anterior aspect of the medial malleolus. Okay. So for the peroneal artery and vein, you can evaluate it from the anterior aspect while present just behind the interosseous ligament. So that interosseous ligament will appear a thin echogenic line while perpendicular to the transducer, and just posterior to the interosseous ligament, you will have a palpating peroneal artery and vein, and you can also evaluate it from the posterior aspect just behind the lateral malleolus. So there is a great deal of variation in the peroneal artery and vein. That's why it will be a bit difficult to differentiate it from the rest of as compared to the posterior tibial artery and vein, because there is the posterior tibial artery and vein is very prominent, and that can very easily be located and differentiated from the rest of the structure just behind the medial malleolus. But just behind the lateral malleolus, the peroneal artery and vein become a great challenge for the vascular sonologist because of its anatomic variation and small diameter. So I think that's enough for today, and we will continue our lecture in the next session. So you'll have to prepare for your Juma prayer, because this is Jummatul Wida, and may you have this Juma for a number of good deeds. So thank you very much for joining us. See you in the next class. Till that, Allah Hafiz.